I'm sure everybody has heard that the body talks, right? But how exactly does it talk? So the video today, I'm going to give you some signs and symptoms that may show up in your body that indicate deficiencies, diseases, and imbalances in general. So first, an alert. If you are a hypochondriac, if you are a person that's very anxious about your health, maybe this video might trigger you, so don't watch it. But all for the other people, it's very important for us to be in tune with your bodies. So ancient civilizations, Chinese, Indian, the tribal people from tribes all over the world, they are very in touch with their bodies. So at the slightest little change, they know what to do. They know that it is a sign of this or that. They might not call it the same name as we do, but they even know how to restore balance. So we have lost that touch. And we don't even observe ourselves anymore. We shower without even paying attention to anything in our body. We brush our teeth and we're thinking about our shopping list, and we dress and we don't even look ourselves in the mirror without any clothes. It's just, it's crazy. We just don't observe ourselves anymore. And we're missing very important signs. So let's start. I'm going to explain to you what normal is. And it's not your job to know what it means when you have something abnormal. That's the healthcare practitioner's job. But if you know what normal is and you know that you're not normal, then it is your job to tell your healthcare practitioner. So sometimes people won't have the time, or they won't be trained. People, I mean your doctor, your nurse, your whatever. They won't be trained in this, or they just don't have time to examine all of this. But it is your job to bring it up, and maybe they can do something about it. So let's start with the skin. So the skin's supposed to be smooth, not too oily, not too dry, not flaky, not red, not burning, not extremely cold in your feet and your hands or everywhere, not wet and clammy, not excessive sweating. So obviously there are genetic variations. Some people are going to have a little bit more oily skin. Some people are going to have a little bit more dry. Obviously you have to use your common sense and know that slight variations is fine. But if you have your your face covered in oil, completely shining, or you sweat profusely and you're not even exercising, then there's something off, right? And don't ignore the signs. Very important to note about the skin are like different spots. So this can be like little moles that came up, warts that came up. Warts are telling you something. Fungus is telling you something. Don't ignore that nail fungus. Don't ignore fungus wherever you got it on your feet or wherever. Rashes, eczema, everything is telling you a story, okay? So moving along, edema. So if you wake up swollen, or if you wake up fine, but during the day, at the end of the day, you're all swollen, you have to bring that up, because that is an indicative, and these two mean two different things. And so this is a sign of some imbalance that can be investigated and treated. Hair. So the hair obviously changes with age, and everybody has different hair. But if your hair is changing its own pattern, then that is a sign. So thinning hair that wasn't thinning before, premature gray hair. So if mom and dad's family did not have premature gray hair and you do, well, then that is a story. That is telling you something that actually you can do something about it and get rid of those gray hairs. So depigmentation, suddenly there's like a stripe of hair right here that showed up that doesn't have the same color as the rest of your hair. That's telling you something. So dandruff is not normal. Itchy scalp is not normal. Hair falling off too much, more than it usually does. It's also not normal. Body hair pattern for both men and women. So men, they were, in their young age, they were hairy. They had hair on their chest. They had hair on their arms and their legs, and then suddenly as they grow older, they don't have the hair on their legs and arms as much, and the hair on their chest is few and far between. That is telling you a story. Women, so they didn't have hair on their bodies, and now they have beards and mustaches and hairs in their nipples and weird stuff going on. That's also telling you a story. Nails. The nails can tell you a ton of stuff. So little white spots is something. Lines that go like this is something. Lines that go like that is another something. Nails that are like spoon shaped. So if you put a drop of water, it wouldn't roll off of your nails. Then that's also telling you a story. And these are little pieces of puzzles that the healthcare practitioner that's trained in this, they can start piecing things together. And this is actually difficult because one sign, like a nail thing, white spots on your nail, it can be 3-4 different things. But then they get the nail information, and they get the hair information, they get the skin information, and the eye and the tongue, and then they piece it all together. So if you have, cuts, little, it's not a cut, but it's like a sore in the corners of your mouth, that indicates a nutrient deficiency or a couple nutrient deficiencies. Your tongue is supposed to be pink. You can see your taste buds. It's not all cracked. It doesn't have like a ton of fissuring. It doesn't have the marks of your teeth on it all the time. When you stick it out, it's not shaking like a vata tongue crazy. And so your tongue can tell you a lot of stuff. Coating on your tongue, coating around your mouth can tell you a big, big story. So bring that up if you have that, and observe your tongue. So in the morning when you scrape your tongue, when you brush your teeth, look at it and, take a mental note. BO, any bodily odor, not just your armpits, your feet, your vagina, your breath. It should not smell too foul. It is normal for you to smell if you exercised and you sweated a lot and you didn't change your shirt. That's okay. And if you've got your feet wet and you have one shoe that has like that stinky odor, that's fine. But if your feet always smell, there's something growing there. If your vagina smells awful, there's something growing there. If you have very, very bad BO, there is something growing there as well. And bad breath, also an indicative of problems. And this can all be treated. So, poop and farts. They are not supposed to be smelling so bad that people have to leave the room once you go to the bathroom or you pass gas. Obviously, they're not going to smell like roses, but they're not supposed to be very, very foul smelling. So when you poop and when you pee, look back and look at the shape. What is normal? Normal is a brown banana that comes out without any straining at least once a day. And ideally, it will not get your butt or the toilet's bowl dirty, too smeary, okay? So that's a good normal poop. Very few people poop like that. The pee is not supposed to be foamy. It's not supposed to be opaque. So it's supposed to be a clear, non-foaming liquid. And it's not supposed to burn when it comes out either. So this So yeah, look back in the toilet. Don't just do your business, flush and go. Everything that comes out of your body is telling you a story. So GI symptoms. Too much burping is not normal. Too much gas and bloating is not normal. Diarrhea and constipation, that's not because you ate something rotten. It's not normal. In the back of your throat, if you have those little stinky yellowish masses, they're not normal either. And then we talked about the tongue, the teeth. So the teeth, it's not normal for you to have your gums, for example, to have lines on them, or for your teeth to have that plaque, that yellow thing, especially here in the back. The bacteria in your mouth is very closely correlated, and it is the causing of many cardiovascular issues. So when they take a plaque that was removed from the carotid, I don't know how to say it in English, but anyway, when they remove the plaque from one of your arteries, and they analyze it, they find that the bacteria that was found there was the same that was found in the patient's mouth. So you have to take care of that mouth of yours. And when you floss and it bleeds, that's a problem. It's not supposed to bleed. So either floss more often or go to the dentist and check it out to see if you don't have periodontal disease, any kind of infection there, because this is very important. You can get very bad heart problems, artery problems because of bacteria in the mouth. Your eyes. So the white of your eyes is supposed to be white. It's not supposed to be yellow. It's not supposed to be blue. And it's not supposed to be red or pink. All of these three things indicate 3 different or more than 3 different problems. Your senses tell you a lot. So if you start losing especially if you're older and you start losing your sense of smell, this is indicative of a problem, and this can be treated if you catch it real early. So the loss of smell in older people precedes Alzheimer's disease and Parkinson's by 5 to 7 years. Can you imagine if you catch this early and you prevent such a bad outcome? Sleep. What is normal sleep? You lay down in bed, 15 minutes, you fall asleep, and you wake up when it's light out or when your alarm tells you to wake up. It is not normal for you to wake up at 3 a.m. or wherever to pee, unless you're very, very old. Or you're a baby. It's not normal. And I'm one of those people. I wake up every single night, and if I look on the clock, it is 2:30 to 3:30. It's always in between that. And that is usually, in my case it is, but for most people, it is a cortisol imbalance. It is a problem in your adrenals, okay? It's telling you that you're way too anxious and that your cortisol is spiking during the night, or maybe you have blood sugar issues at night. So your blood sugar drops, your cortisol spikes in response to that stress. So there are strategies that you can do to help you with that. Don't ignore it. Your vitals, so your heart rate, if it's different than it's usually, something's wrong. If your respiratory rate, before you could go upstairs and not feel winded and now you're feeling winded, there's something there, right? Your temperature can tell you a lot. Do you know how women measure their temperature when they're ovulating to know if they want to have the baby or not? Well, your temperature also tells you about your thyroid function. Our enzymes all work in an ideal temperature. So if your body is too low or too high, your enzymes are off, and we're commanded by enzymes. Everything in our body is run by enzymes. And then finally, body shape. So body shape, obviously you were born with one, but if it changed, then that's telling you a story, especially when the waist-hip ratio is different than it used to be. It's definitely telling you something. So your body talks to you, and these are the ways it talks to you. It changes your skin, it changes your hair, it changes the color of your eye, it changes the luster in your skin, your hair, your eyes. And so look yourself in the mirror, look at your body and examine and bring it up to your healthcare practitioner. Your health is in your hands, not their hands.